It's a growing health epidemic affecting an estimated 26 million Americans every year. 67,000 people die from it, and 1 in 9 adults have it, but most do not even know it. Chronic kidney disease, or CKD, can be a life-threatening condition which occurs when a person's kidneys no longer clean toxins and waste products from the blood or perform their other functions normally.
Kidneys have multiple tasks that they perform for us. They regulate our fluid balance, our body chemistry, help control the blood pressure, help to prevent anemia, and when the kidneys fail, all of those processes are basically impaired, and that's when dialysis may become necessary.
Responsible for about 40% of all kidney failure, diabetes is the leading cause of CKD. High blood pressure also contributes to the development of CKD and is responsible for about 25% of kidney failure. But there are other risk factors as well.
Other than diabetes and hypertension, there are risk factors such as exposure to medications which may be poorly tolerated by the kidneys, trauma. Some people have urinary tracts that didn't form properly either at birth or right after that can lead to obstruction and blockage, which harms the kidneys over time.
While kidney disease can develop suddenly or over time, certain ethnic groups are at much greater risk for developing this deadly condition.
African Americans have a very disproportionately high level of kidney disease, and if you look at the populations in dialysis units, typically a third of the patients are African Americans, whereas I believe they represent about 12% of the American population. The elderly are at high risk. Pacific Islanders, Native Americans, and Alaskans also are among groups that have higher incidence. Hispanics are included as well.
Because people in the early stages of CKD often have no symptoms, medical experts say early blood testing is critical for those most at risk. When left untreated, the condition may lead to the need for dialysis, a life-sustaining treatment that removes waste products from a patient's blood and takes the place of lost kidney function. Davita is a leading provider of kidney care in the United States, caring for more than 110,000 patients in different stages of CKD. Davita is dedicated to generating awareness about and delaying the progression of chronic kidney disease. One of their main goals is to educate members of ethnic groups who are at increased risk for CKD about the importance of early testing and detection.
Early screening can be done in a simple blood test through a normal panel. There's one of the tests, it's a creatinine test, and it will tell the doctor how your kidney is functioning. Once a doctor sees that your kidneys aren't 100%, they can change your diet, give you exercise routines, and it can either delay or prevent kidneys failing.
Doctors say early detection and proper education, along with a health plan designed by an individual's nephrologist, patients with CKD can live a long life.
Dialysis is a replacement for kidney function. It doesn't help to restore kidney function. It's like having an extra kidney outside of your body. There are many options in dialysis, and what it does is to replace the function of the kidneys, such as managing fluid, clearing waste, restoring the body chemistry to normal. Patients now have a lot of options with dialysis. They can do hemodialysis, which is passing their blood through a dialysis machine in a center. They can do hemodialysis at home. There's also peritoneal dialysis, where patients instill fluid into their abdomen several times a day and there's no passing of blood through a machine. And all of these have become, I think, technically easier for patients with the advances in dialysis. And with many more options available, part of the early intervention is instructing people about all these options and how they work.
Without the Davita system, I would not be able to continue my career. They have made it so easy for me in making arrangements to travel from city to city. In just the past month, I've been in Green Bay, Wisconsin, New York City, Houston, Texas, and each time my care plan goes with me. They make all the arrangements and send my treatment plan, so it's not that I'm new. They know me before they've even met me.
America's leading kidney care company, Davita is committed to leading the way in creating greater awareness of CKD through early detection and delaying progression of chronic kidney disease.
I think everybody should be screened because it is such a simple test, and again, very low symptoms, so everybody should get screened. But if you were to focus it, everybody that's diabetic, that is hypertension, or belongs to a minority class, African Americans, Hispanic, Native Americans are more prone to have kidney disease.
If you suspect you have CKD, Davita cares and urges you to get screened and, if necessary, begin care. Please check with your doctor and get evaluated today. For more information about chronic kidney disease, contact Davita or visit davita.com.